as the leader pointed out, have had a fairly consistent position among Republicans for some time, and that is that we need a targeted, fiscally responsible approach to coronavirus relief. And the Speaker, Pelosi, has said consistently up until this last week that they needed started out, I think, $3.4 trillion, then it was like $2.4 trillion, and now all of a sudden she's okay with a smaller package because they're going to address this next year. Like, where has this view been for the last 7 months when we've been trying, as the leader pointed out, to get those things across the finish line that we all agree with? And it is absolutely true that there are a series of things on which there's bipartisan agreement. Certainly liability protection, state and local, that's not the case. And I would argue, as he did, that there are lots of states around the country that are in a pretty good condition fiscally right now. Mine would be one of those. And there are a lot of our members who have big reservations about borrowing money to basically bail out a few states who maybe because of their own actions are in a bad fiscal situation. So I think the important thing here is that we focus on that range of issues on which there is broad agreement, and clearly that is money for vaccine, distribution of the vaccines, PPP, small businesses, people who are unemployed, extension of some of those programs, and I think we could get a deal and tie it into, let it ride on the year-end budget deal and do something really meaningful for the American people. One thing that I would argue needs to be on that is a provision that prevents states from taxing healthcare workers like doctors and nurses who go across state lines to provide their services. That is an act of goodwill. They shouldn't be faced with a surprise tax bill. And I think there ought to be a provision in this legislation that makes it clear that people like that, or people who are frankly working remotely and have tax consequences as a result of that, don't get hit with a big fat tax bill by some state. New York is a good case in point, and I would hope that we could get that done, and I think we can if Senator Schumer, who of course represents the state of New York, and I'd said the state of New York is one of the biggest culprits when it comes to taxing people who work mobily, if he would back down and allow this to be included in this package, it would be of immense help to not just those healthcare workers who are traveling across state lines to assist during the pandemic, but also a lot of other workers who are working remotely right now and are going to be faced with a big tax bill as a result of that. That shouldn't be allowed, and it should be part of this coronavirus relief bill that we move through the Congress.